Every 90 seconds, someone in America has a stroke while sleeping, and one sleeping position makes this 47% more likely. Tonight, millions of people will sleep this way, not knowing the danger. What if the way you sleep is hurting your brain every single night? In this video, I'll show you which position is dangerous, why it's bad for your brain, and which position can actually protect you. But first, let me tell you about Vernon. Vernon was 59 years old. He was a football coach for 34 years. His team just won a big game. That night, he went to bed happy. He lay on his back like always and fell asleep. Around 3 in the morning, something terrible happened. A blood clot in his neck broke loose. It traveled up to his brain. It got stuck in a tiny blood vessel. Brain cells started dying, and Vernon slept right through it. His wife found him the next morning. His face was drooping. He couldn't speak right. He couldn't move his left arm or leg. Vernon had a massive stroke. After months in the hospital, Vernon can now walk with a cane. But he can't button his own shirt. The doctors told him something scary. They said sleeping on his back may have helped cause this. Why does sleeping position matter? Your brain has a cleaning system. Scientists discovered it in 2012. They call it the glymphatic system. Here's how it works in simple words. When you sleep, your brain cells shrink a little bit. This makes space between them. Then, special fluid rushes in like water from a hose. This fluid washes away bad stuff, like garbage being taken out of your house. One thing it removes is a protein linked to memory problems. Your brain needs to clean this out every night. But here's the important part. This cleaning system works differently based on how you sleep. Scientists tested this. They found that sleeping on your side lets the brain clean itself much better. Sleeping on your back? The cleaning system doesn't work as well. Think of it like washing dishes. Sleeping on your side is like using hot water and soap. Sleeping on your back is like using cold water with no soap. The dishes don't get as clean. A study from 𝗗𝗿 University found something alarming. People who sleep on their backs have a 47% higher chance of having stroke signs when they wake up. That's almost half more likely than people who sleep on their sides. Why is back sleeping so risky? There are a few reasons. First, blood flow problems. When you lie flat on your back, your head presses against the pillow. This can squeeze the blood vessels in your neck a little bit. These vessels carry blood to your brain. When you're young, your body handles this easily. But as you get older, your blood vessels get stiffer. They don't flex as well. That small squeeze becomes a bigger problem. 8 hours of pressure, every night, year after year. Second, blood can pool and form clots. When you're flat on your back, blood doesn't flow the same way. It can collect in certain spots. This makes it easier for clots to form. Remember Vernon? A clot formed while he slept on his back. That clot destroyed part of his brain. Third, worse snoring and breathing problems. When you sleep on your back, gravity pulls your tongue backward. This can block your airway. You might stop breathing for a few seconds over and over. This is called sleep apnea. Every time you stop breathing, your blood oxygen drops, your heart races, your blood pressure spikes. This happens many times each night if you have this problem, and back sleeping makes it 50% worse. A big study looked at over 4 million people. They found that sleep apnea makes stroke risk 2 to 4 times higher. Meet Constance. Constance was 63 years old. She snored loudly. Her husband slept in another room because of it. She thought snoring was just annoying. She didn't know it was dangerous. One morning, her husband found her confused. She kept asking the same questions. Her face looked different. At the hospital, they found she'd had a stroke during sleep. The doctors did a sleep test. They found she stopped breathing 72 times every hour. That's more than once per minute. Her oxygen was dropping dangerously low every night. She'd been slowly hurting her brain for years without knowing. The best sleeping position. So what should you do? Sleep on your side. Research shows side sleeping is the safest. Your brain cleans itself 25 to 30% better. Your airway stays more open, blood flows better. Sleeping on your left side seems to be the best, but either side is much better than your back. How to sleep on your side. The right way. Here are some simple tips. Pick the right pillow. Your pillow should be thick enough to keep your head level with your body, not tilting up or down. Most people need a pillow about 4 to 6 inches thick. Put a pillow between your knees. This keeps your hips straight and takes pressure off your back. Bend your knees a little. Don't sleep straight like a board. A slight bend is more comfortable. Don't sleep with your arm under your head. This can make your arm go numb and affect blood flow. How to change. If you're a back sleeper, changing how you sleep isn't easy. You've done it the same way for years, but you can learn. Try the tennis ball trick. Sew a pocket on the back of a sleep shirt. Put a tennis ball inside. When you roll onto your back, the ball makes it uncomfortable. You'll roll back to your side without fully waking up. Use pillow barriers. Put big pillows behind your back. They stop you from rolling over. Be patient. The first week is hard. You might sleep badly, but most people adjust within 2 to 3 weeks. After that, side sleeping feels normal. Some signs that something might be wrong. Waking up with headaches most mornings, numbness or tingling when you wake up, feeling confused when you first wake up, dizziness when you get out of bed, snoring loudly or waking up gasping. If you have these signs, talk to your doctor. Don't ignore them. Patricia was 66 years old. She had high blood pressure even with medicine. She started sleeping on her side. Within a month, her morning headaches went away. Her blood pressure dropped. Her doctor lowered her medicine, all from changing how she slept. Jerome was 62. He'd already had a mini stroke. He was terrified. When he learned about sleep position, he switched to side sleeping. His snoring got much better. 2 years later, no more problems. These aren't magic cures, but they show what can happen when you make simple changes. What to do tonight? Here's your plan. 1. Sleep on your side. Left side is best. Either side is good. 2. Get the right pillows. 1 for your head, 1 between your knees. 3. Use the tennis ball trick if you keep rolling onto your back. 4. Watch for warning signs. Talk to your doctor if something seems wrong. 5. Be patient. Give yourself 2 to 3 weeks to adjust. 6. Tell someone you love. If your partner sleeps on their back, share this with them. Every night, millions of people sleep in a position that could hurt them. You don't have to be one of them. Tonight, you can make a simple change that costs nothing. Sleep on your side. Let your brain clean itself properly. Give your heart a rest. Your body wants to protect you. Help it do its job. Sweet dreams on your side. Take care of yourself. I'll see you in the next one.